In Chapter 2, we're looking at safe and smart physical activity. By the end of Lesson 2.1, you will be able to explain how to prepare yourself for physical activity, explain how the environment affects physical activity, and describe some steps for dressing for physical activity in normal environments. Whether you're a beginner or you've been physically active for some time, it's important for you to be prepared and to know how to exercise safely in all conditions. Environmental conditions play an important role in determining when and how strenuously you exercise. Whether you're just beginning a physical activity program or you've been exercising for a while, understanding how environmental conditions can affect your body during exercise is important. Your body is able to adapt to environmental factors such as heat, cold, and altitude. Be careful when performing physical activity when the weather is hot and the humidity is high. Hyperthermia, or overheating, occurs when your body temperature rises too high. Exercise in the heat causes your body temperature to rise and you start to perspire, or sweat. When sweat evaporates, the body is cooled. But when the humidity is high, evaporation is less effective in cooling the body, and hyperthermia can occur. Hyperthermia causes three main conditions. Heat cramps, which are muscle cramps caused by excessive exposure to heat and a low consumption of water. Heat exhaustion, a condition caused by excessive exposure to heat, characterized by paleness, cold, clammy skin, profuse sweating, weakness and tiredness, nausea, dizziness, muscle cramps, and possible vomiting or fainting. Body temperature may be normal or slightly above normal. Heat stroke, which is a condition caused by excessive exposure to heat, characterized by high body temperature, possibly as high as 106 degrees Fahrenheit, hot, dry, flushed skin, rapid pulse, lack of sweating, dizziness, or unconsciousness. This is a serious condition and can result in death and requires prompt medical attention. So, what are the guidelines to prevent and cope with heat-related conditions? First off, begin gradually. Drink water. Wear proper clothing. Rest frequently. Avoid extreme heat and humidity. And get out of the heat and cool the body if heat-related injury occurs. Exercising during cold, windy, and wet weather can be dangerous. Extreme cold can result in hypothermia, or excessively low body temperature. Hypothermia is accompanied by shivering, numbness, drowsiness, muscle weakness, and confusion or disorientation. You should follow these guidelines when exercising in cold, windy, and wet weather. Avoid extreme cold and wind. Dress properly. Avoid exercising in icy or cold, wet weather. Conditions other than weather, including air pollution and altitude, can influence the effectiveness and safety of exercise. High levels of air pollution affect your breathing ability. Radio and television stations usually issue warnings when air pollution levels are high. Avoid exercising outdoors during these times. People who live at high altitudes are able to exercise with little trouble. However, people who live at lower altitudes might have trouble adjusting to higher altitudes. Even if you are physically fit, allow your body to adjust to higher altitudes by first exercising at low intensities for limited periods. The time you spend doing physical activity on any given day is your daily physical activity session or exercise session. A good, safe activity session has 3 stages: a warm-up, a workout, and a cool down. A warm-up is a series of activities that prepares your body for more vigorous physical activity, enhances performance, and helps prevent injury. A warm-up usually consists of a heart warm-up and a muscle stretching warm-up. The heart warm-up increases the total body temperature, as well as increasing muscle temperature and blood supply to the muscles. Warm muscles contract and relax more efficiently than cool muscles. The muscle stretching phase of the warm-up consists of exercises that slowly stretch the muscles to loosen and relax them. After a workout, your body needs to recover from the demands of physical activity. A cool down usually consists of a heart cool down and a muscle cool down or stretch. A heart cool down consists of movement done at a slower pace than the workout. The heart cool down helps prevent dizziness and fainting. Hard exercise causes an increased flow of blood to your muscles. As a result, you may feel dizzy or faint. But if you continue walking after a hard run, your muscles will squeeze the veins of your legs, helping the blood return to your heart. Your heart will then have more blood to pump to the brain, and you will be less likely to feel dizzy or faint. Lesson 2.2, Physical Activity and Injury. In this section, you will be able to list and describe some activity-related physical injuries. You'll be able to list some guidelines for preventing injuries during physical activity, and you'll explain how to apply the Rice formula to the treatment of physical activity. You know that physical activity has many advantages to your health and wellness, but if physical activity is not done properly, injury can sometimes result. Most injuries are minor, but can be prevented if care is taken. If you have ever suffered an injury related to sports or exercise, you know that an injury can be quite painful, even if it is not serious. Some of the more common minor injuries related to sports and exercise are sprains, strains, blisters, bruises, cuts, and scrapes. More serious but less common injuries include joint dislocations and bone fractures. One type of injury is called an overuse injury. These injuries occur when you repeat a movement so that wear and tear occur to your body. You are probably familiar with common overuse injuries like blisters or shin splints. A side stitch is a pain in the side of the lower abdomen that people often experience in sports, especially running activities. Side stitches are most common among people who are not accustomed to vigorous physical activity. Another type of injury is called microtrauma. Microtrauma is an invisible injury. Often these injuries do not cause immediate pain or soreness, but with repeated use, symptoms of the damage eventually appear. You may know that your body is made up of about 206 bones that connect at joints. A ligament connects bone to bone, and a tendon is a tissue that connects muscle to bone. When your muscles contract, they pull your tendons and make your bones move. The bones act as levers and work with your muscles to allow body movement. But when your muscles move in your body, they exert a force on those bones. These forces can cause medical problems if you do not use correct techniques when doing physical activity. The same principles used in physics and engineering to study forces can be applied to help living organisms function efficiently. These principles are called biomechanical principles, and they can help you use the levers of your body, your bones, to move more efficiently and avoid injury to the joints and other body parts. One important principle you should remember as you do physical activity is that you should not force your joints to move in ways that they were not designed to move. Another principle to keep in mind is that your movement should not overstress bones, tendons, ligaments, or muscles. A third principle to remember is that you should balance the muscle development around a joint so that all the muscles will develop properly. As you perform your regular physical activity, keep those important biomechanical principles in mind by following some simple guidelines to reduce the risk of common injuries. Start slowly. Listen to your body. Warm up before activity and cool down after activity. Be fit, use moderation, and dress properly. When injuries occur, it is often necessary to seek medical help. However, you can take immediate steps to reduce the pain or prevent complications of the injury. It is good to know First aid so that you know what steps to take when injuries occur. For muscles, strains, sprains, and bruises, which are common in sports and other activities, you can follow the Rice formula. R is for rest. After first aid has been given, the body part should be immobilized to prevent further injury. I is for ice. Ice for 20 minutes, starting immediately after the injury to help reduce swelling and pain. C is for compression. Use an elastic bandage to wrap the injury to help limit swelling. E is for elevation. Raise the body part above the level of the heart to help reduce swelling.